Hi everyone, this is Dr. Konstantin. I'm a facial plastic surgeon and New York-based facelift expert. And today we're going to talk about the subject that comes up a lot in discussions with my patients. We're going to go over a group of facelifts that have trademarked or proprietary name. And a lot of people know that name and they're wondering what is it and how does it work? Is it a real facelift or it's something else? So we're going to talk about a group of facelifts such as S-lift, Y-lift, lifestyle lift, ponytail lift, and we'll discuss what are those and what can they do for you. The first one is a Y-lift and it's a trademark name. Of course, I'm basing all the opinions in this video on the website of people who developed this procedure, and I'm just gonna give you my interpretation of the things that they say on their website. I have no first-hand experience with this type of procedure because obviously it's proprietary, it's trademark, and only people who develop this kind of procedure can legally do this. So what is the Y-lift? And they seem to be several different components to this procedure. So one component is volumizing the face. So putting the filler in specific areas of the face. We know this can lift the face and improve the appearance of sagging. For example, putting filler in the cheeks, making the cheeks look bigger, is going to lift the cheek and help to minimize the appearance of the jowls, right? So this is one of the techniques that this procedure relies on to rejuvenate the face. Another technique is the use of energy devices. And energy devices, I believe something like radio frequency they use, is going to help to tighten up the skin after removing the fat. For example, with the liposuction, that energy is going to create some scar tissue under the skin and it will tighten it up, right? So this is the second component of this procedure. And a third component of the Y-lift is the suture tightening. So the suture, and they don't go into great details how it's done, but I can tell you just from my other experiences that typically in those situations, the suture is passed from one area to the other area, going around the neck and under the ears, and the suture is tightened up and it helps to maintain the shape of the neck for at least a period of time. So those three components, and of course not everybody needs them all, so I would imagine when you go for consultation for Y-lift, the doctors would discuss it with you and they would tell you, well, these are the procedures that we're going to do for you, and this will help to rejuvenate the face. Now, of course, like with any other procedures, there's good and bad in this situation. So a good thing that this is really minimally invasive. So Y-lift, it's not surgery. It could be a surgical procedure. For example, putting the suture around the neck is considered to be a surgical procedure because you have to poke through the skin. But it's really no cuts or stitches usually involved in doing that. And the same thing with using the fillers. It's a procedure, but it's not surgery. So that's a good thing. You get no cuts, you get no scars, right? So the things that some people may say, well, this is probably something that would not be ideal for me, is the fact that a lot of this is temporary. So when we put a filler in the cheeks, for example, hyaluronic acid fillers, those will last for about a year or two, and then they go away and you have to go for another procedure. So unlike a surgical facelift, this type of procedure is temporary. The same thing happens with the other type of tightening, like radio frequency and the suture tightening. The surgeons, or not necessarily a surgeon, if it's not surgery, it could be done by not a surgical medical provider. This type of techniques rely on the skin's ability to shrink. So when the fat is removed under the chin, for example, and the skin becomes lax, so it can be tightened up with the sutures or with radio frequency. And with some people, it will happen quite easily and they will have a nice neck contour. And with other people, in my experience, it doesn't happen at all. So in those situations, the procedure would be ineffective and people would still have some sagging under the chin, and they would require another surgical procedure or another surgery to fix it. So number one of the things that people oftentimes don't like with this kind of procedures is that it's temporary. And number two, the results are not 100% consistent. So oftentimes the surgeon with experience or the doctor with experience can tell you that, well, this is going to work for you, and you may not get such a great result. Sometimes they would tell you, but oftentimes our judgment isn't perfect. So when you're getting one of those procedures, you should always be expecting that there's going to be definite variability. It might work very well for you or may not work so well, and you would need some additional procedure or something else if you're looking for a better result.